Guys, so today we'll be talking about the fertilizations. So let's define what is fertilization first, and we'll go from there. So whole concept, look, let's just say this. What is fertilizations? Whenever, let's just say this is a male gametes, right? And plus, let's just say the female gametes meet together, right? When they fuse together, then this whole process is called fertilizations, all right? So when the fusions of the male nucleus and with the female nucleus, right, to form basically something called what? To form a zygote, and this process is called fertilizations, right? Now this is what we'll be talking about here. And what are they ultimately? What do they make is that you make a basically, let's just say, for our case, let's make this as a blue right here, and this is let's just female, and then we can simply say that when they fuse together, you basically make something called combinations of a male and female, right? Now this is called zygote, right? And remember, this is zygote is the one that is going to make one of us, right? Now how does this fertilizations occur? Now that's what we talk about. Okay, so normally if you look at this structure right here, this is, okay, let's just say cervix, right? Let's just name this. This is your uterine cavity, right? Uterine cavity. You have, this is really important, you have to say fallopian tube, right? Fallopian tube, or we also call them a uterine tube, all right? Uterine tube is there. And if you look at it down here, this area right here, we call them a infundibulum, right? This is basically a fimbriae right here. And then maybe like we can make little dilated portions, and that dilated portion is called ampulla. And this is the one that you have to remember, ampulla, because normally fertilization takes place at where the ampulla region, it's a dilated regions, all right? On the uterine tube, you see it. And sometimes they ask you these questions where the fertilization takes place, and that is an ampulla. If fertilization does not take place in ampulla and it takes us somewhere else, then usually that can lead into ectopic pregnancy, all right? Now basically how this process begins, right? How does the human developmental process begin? That's what we're talking about. So normally, obviously, we have to talk about during sex, right? When they're doing a male and female intercourse, right? What happens is that normally this male sperm right here is sort of ejaculated in female genital tract, right? So this is a vagina, right? And normally different books may say different numbers, but usually it's more than 100 millions of basically, let's just say 100 millions sperms are actually ejaculated in the female genital tract. Remember, this whole process of the sperm actually getting deposited into female genital tract, right? This is called inseminations, right? This is inseminations. But remember, you have to think about this. But the fertilization takes place, it has to get all the way down here, right? But how the heck the sperm actually travels all the way down here? This is what we're talking about now. So look, whenever we talk about the sperm right here, look, if you look at the sperm, look at the structure of sperm. If this is a sperm, right? This sperm has like this head, your head, right? And then it has this body, and it has this tail end, right? So this is what happens. And basically, look, one of the most important things you have to remember is that the sperm generally is basically alkaline, right? It's sort of alkaline, right? And when you talk about the, let's say, vaginal fluid around the vagina, it's acidic. There's also like bacteria called lactobacillus bacteria is also there, right? And those are usually the normal flora of the vaginal fluid, right? So basically, whenever the sperm get deposited into the female genital tract, the sperm does not survive for that longer period of time. Normally, sperm can actually survive for sperm can be, let's just say, survive or alive for maybe 3 days, or maybe we can simply say 72 hours, right? 72 hours. But the sperm that is actually, which can induce fertilizations, or which are extremely viable, those they become extremely viable, not up to 3 days, but basically in 48 hours. in these 48 hours, basically what happens, these are super active. They are extremely viable, all right, to induce fertilizations. And this is something to remember. But remember, when that 100 million get deposited, let's just say, some books says like more than 200 million, but but most of them, all right, majority of them, they basically here, they die because, as we said, the sperm is alkaline environment, and then when you basically get into vagina, because of the acidic conditions, they destroy. That's one of the things that happens, right? And also, okay, let's just write down here. So vaginal pH, right? So vaginal pH, this is the one, they destroy the sperm, one. And second, there's also like some like this normal flora, like this bacteria. Because of that, they also destroy that sperms. Not only that, look, there's some enzymes, like for example, white blood cells are on there, right? They also basically destroy the white blood cells. They also destroy the sperm. So basically, only about 1,000 sort of a sperm actually get to this ampulla. And the way it does is this, when these sperm get deposited here, this because of that, the vaginal pH, they become a little more alkaline. That's what that happens, right? It basically, it just neutralizes the acidic environment. That's what happens, right? And on top of that, there is a release of, there is an enzyme, this sperm can release this, right? Which can actually coagulate. They can do that, right? They can do that. On top of that, there's also secretions of, like, for example, prostaglandins, right? And this prostaglandin, what do they do is that, remember, these prostaglandins, they make the cervix, right? Thin, okay? Then because normally, due to presence of like estrogen, right? What happens is that during the presence of estrogen, normally these are thick and viscous, right? And then usually in that case, right, what happens? They cannot travel, right? They can't travel. So what happens is like you have to make it thin. You have to make this thin, right? So that way these guys can actually travel through it. So what really happens is that there's a release of prostaglandins and they can make a thin and sort of like environment, like beautiful environment for this sperm to actually go through this, all right? Now, so basically what happens is that when there's a sperm, let's just say travel all the way down to uterine cavity, right? What happens, they can either, let's just say they can either go to this directions because there's also another uterine cavity, and it comes all the way down here, right here, look. Okay, the sperm is right here. Now, and usually look, a sperm to travel to get to here, right? It can reach here within less than 5 minutes. They're so motile. That's what that happens, right? And when the sperms are here, right, the sperm usually waits for the egg to arrive. That's really happens, right? And the way it does is that, and how the heck the egg, this whole fertilization begins is that because if the egg is not released, you know what I mean? Because it takes within the 5 minutes, and then it can survive up to, let's just say, 48 hours or 72 hours. But if it doesn't reach, then what happens? They can no longer survive. So this is also a very important concept to remember. So now, if you look at this is ovary, right? Right, in the ovary, what really happens is that, in the female normal cycles, let's say if we go, let's just say by 30 days, if her of a normal cycle 30 days, then what is her basically ovulation day? Usually what you do is that you basically, if it's a 30 days, then, okay, let's just write down here, right? There's a follicular phase and there's a luteal phase, right? And normally, look, you have like this, right? A luteal phase, this is, let's just say, a lat surge, right? And if this is like, let's just say 30 days, then you basically do 30 minus 14, right? Then what do you get? You get 16, right? Her 16 days will be the ovulations day, right? Now, basically now, this is ovulation. So what happens after ovulations? Remember really what happened after the release of LH hormones, right? And after the LH, really what happens is that the oocytes, right? These oocytes, it basically, the female oocytes, right? Let's make this as oocytes right here, and these are, okay, it has, what else it has? It has this layers of the cells. What is this layers of cells? This is basically, okay, let me write it down here. This is called your corona radiata, right? It is just the layers of the granular cells, of follicular cells, right? And then you have this green layer. This greenish layer is called zona pellucida, right? And sometimes they also call this as a jelly coat, right? And then the inner layer, this layers, which is called basically it's called vitelline membrane, all right? And what is vitelline membrane? It's nothing but it's the plasma membrane of the oocytes. The plasma membrane of the oocytes, we call them a vitelline membrane, right? And you have a granular layer and you have a nucleus, right? Remember, this whole cell is what is it? This whole cell is this oocytes, right? This is an ovum, we can simply say. But these oocytes, you know what happens? After the ovulation, because of LS surge, what happens is that this secondary oocytes, right? What happens is that it gets ruptured, right? And then basically what happens is that when it gets ruptured, they sort of like come together and, you know, make the oocytes are, let's just say if this is oocytes, when it get ruptured during the ovulation process, really what happens is that, let me make this here. You know, this is, let's just say you have this, right? And then after that, you have this plasma membrane, and then this is basically surrounded by the oocyte, surrounded by genera pellucida, and on top of that, you also have this corona radiata, right? It makes these layers of the cells like this, right? Now, this is, and inside that there's a nucleus right here, right? So basically, what is happening here is that these guys, right? They haven't yet. These guys are secondary oocytes, right? And what happens is that these secondary oocytes usually they are arrested, or what? They're arrested at this phase, which is the meiosis. Okay, it's the meiosis 2 of the metaphase, and you have to remember this. Sometimes they have to ask this, and normally what happens is, and they're arrested when the let's just say the Graafian follicles. So let's just say when the secondary follicles, when they got ruptured, you know, the secondary oocytes releases, right, and then really what happens is that secondary oocytes which releases, which has arrested in the meiosis 2 of the metaphase, right? Meiosis 2 of the metaphase, right? And really what happens is that when the oocytes get released, the secondary oocytes get released, really what happens is that this, look at this. This is an ovary, right? From here you get ruptured, and then this is your fallopian tube, right? And the fallopian tube, this have this finger-like projections are coming out, right? This finger-like projections have the shucking axis, right? That basically takes this cells, which basically these cells right here, okay, let's make this as green, and takes it like this, and it's sort of like like this, and it takes it with it, right? It sucks it up, because there are some enzymes which actually get releases here too, right? And that attracts this secondary oocytes to get picked by this fimbriae and get sort of like deposited down here. That's what happens. Right? Now, when the follicles actually get ruptured, right here, if you see this, what happens is that there is a release of the secondary oocytes right here. You see this? And then what is that going to lead into is that, you know, this fimbriae right here, they actually pick up the secondary oocytes, right? That's what happens. Now, and when that happens, right? Remember, they still at the secondary oocytes, right? It hasn't completed the secondary meiotic divisions, right? It hasn't completed. It will complete it later. It hasn't completed here right now. But one thing that you have to remember here is that, you know, that when oocytes during the ovulation, this oocyte, secondary oocytes gets released, and then it has been taken by this fimbriae of the uterine tube, right, and takes it into the fallopian tube. That's something that you have to remember, right? Now after this, look. Now what happens is that now let's just say this egg, okay? This egg arrived here. We have to say this. Now, it is a very, very important concept here. And let's just make this as, all right, what is this? Now, let's just say this egg is arrived here. We'll just put it here. And let me draw this for you guys. Hold on. Okay. So here, let's just say this egg right here, right? That is that. And you have this green layer right here. Right? That is genera pellucida. And you have this corona radiata. Look what is happening here. So it's here now, right? Now, how does this fusion process works? This ovum has barriers, right? Now, this is all barrier they're playing with. Now, let's just talk about what are the barrier these oocytes actually making. You know, this is number one. There is a corona radiata is there, right? Corona radiata is there. Second, what is else there? There is a zona pellucida, or we also call them a jelly coat. And then third, you also have the plasma membrane, or simply call them the vitelline membrane. Look, this is the oocytes barriers, all right? That sperm has to penetrate to basically for the fertilization to occur. Remember what fertilization basically means? Fusions of the male and paternal and maternal nucleus, right? To make, what is to make what? To make, is to form basically a zygote, right? Now, it has to basically have this, it has to pass this barrier. On top of that, look at this sperm. This sperm also had its plasma membrane, right? This sperm also has this plasma membrane. And this plasma membrane, right? Which plasma membranes sperm has? This plasma membrane, also prevents for the fertilization to occur, okay? So basically what happens? What happens is that this sperm also has to break this plasma membrane, right? For the fusion to occur, right? And how do they do it? As they coming down, as this sperm comes down here, right? Really what happens is that, this sperm as its weight for the egg to arrive, really what happens is that, this sperm is basically going something called process of destabilizing. What does that mean though? Basically started removing the glycoprotein or glycoprotein that is coated around the head of the sperm, right? The whole process of, removing this glycoprotein or the cholesterol layer, that process is called capacitations. And this is something that you remember. And now let me write it down this for you guys. Very important. There's something called capacitation happens. And what is this capacitation means? There is a phase 1, all right? And there is a phase 2 is there, right? And what is this phase 1? Basically, the sperm have this cholesterol layer, right? And removal of the cholesterol layers, and also the whole let's just say, we can simply say that the sterol layer, right? Or let's just say cholesterol layer, that, right? That, and on top of that, the removal of this glycoprotein coat is what is called capacitation. And that needs to happen, okay, for basically sperm to what? Sperm to penetrate through this, okay, the corona radiata. And when they remove this glycoprotein, right? Let's just say when they remove these glycoproteins, when the sperm removes the glycoprotein right here, look, let's just say this. This is a sperm right here, right? And have this layers. Now let's just say this layers, okay? The sterol layer, that gets removed, let's just say right here, right? The plasma membrane. And when they happens, right? Because it's fusing with the corona radiata, right? So when that happens is that this sperm also releases, right? What happens, start rubbing against the corona radiata, and it releases what? Releases basically enzyme, right? What is the enzyme is called? Like for example, this hyaluronidase enzyme, right? Because there's a lot of this hyaluronic acids out there, right? This hyaluronic acid is there, right? And basically, this hyaluronic acid prevents this sperm to basically cause the fertilizations. So what really happens is that there is an enzymes which releases by sperm, which is called hyaluronidase enzymes, that actually breaks down this hyaluronic acid, right? Now, this hyaluronic acid. Now, what is this concept? When they break down, then really what happens is start breaking this corona radiata now, right? Now, when they started breaking this corona radiata, right, what really happens? Now and then what happens is that this sperm as it slowly moves and it tries to penetrate the zona pellucida layer, right? Remember, sperm has its receptor, all right? Sperm has its receptor, and which is called SED1, which is basically called, what is this called? Sperm egg adhesion 1, right? And the zona pellucida, the zona pellucida, there's a glycoproteins layers out there, right? And these are usually GP1, GP2, ZP3, right? The different layers, and you have to remember something called GP3, because this is called sperm binding proteins. There's another name is called sperm binding protein, right? Receptor. When sperm comes, and SED1 actually fuses with the GP3 receptor, what happens is that whenever that happens, you have to think about that there is what? There is a fertilization has begun. Remember, fertilization is like a 24 hours period of time. It takes, right? So whenever there's a fusion, so really what happens is that this happens right here, right? This is called, this is basically, then you can simply say that there is a fertilization has begun. All right. Before, look, right after this space right here, after the plasma membrane, but this is called vital space or periplasmic space. Okay. So the two concepts that you have to remember when there is a pass of look, one of the things you basically basically for fertilization to occur, there are a couple of concepts. One of the things they have to go is process capacitations, right? Removal of glycoproteins and all that. And after the second thing that needs to happen is that acrosomal reactions. This is a very, very important concept. And what is an acrosomal reaction is, look, when the genera pellucida, whenever sperm fuses with this membrane right here, right? This genera pellucida, right? Really what happens is that this acrosome, right? That basically means there's acrosomal reactions happen. And that basically releases what? Acrosin enzymes, right? And what happens is that there's a release of acrosin enzymes. And these acrosin enzymes, what they do is that, look, what are the acrosin? It is a proteolytic enzyme. It started breaking down the other components, all right? Other components around them. And that helps fertilization to occur. And this is very, very important that you have to remember. And remember, there's some other enzymes too, but for the more important concept, you have to go through process for the fusion, there has to be acrosome reaction that needs to occur. And second thing that needs to happen is that basically capacitation needs to happen and acrosome reactions happens. Now, when let's just say this sperm comes in all the way down here, right? And when it comes down here and then it's penetrated through now genera pellucida, right? As soon as when it penetrates the genera pellucida, really what happens is that, if there's other sperms out there, it prevents other sperm to actually fuse with the one egg. Remember, if there's more than one sperm, let's just say the two sperms are there and they try to three sperms are trying to fuse with this, right? What happens? That can lead into something called polyspermy, right? And polyspermy is basically like, it happens rarely, but which basically means that, you may have, because there's one egg and there's a two or three, sperms is fused with the one egg. And that can result into basically, you could born with the multiple genital tract. What does that mean? Meaning that you could have a male parts and also female parts. Like for example, you could have a male on one side, you could have a male breast, on the other side you can have a female breast, right? That's one of the examples of the polyspermy. So what really happens is to prevent the polyspermy, right? When it fuses to the genera pellucida, really what happens is that actually instead of saying genera pellucida, now let's just say this egg, it comes and penetrates the genera pellucida, it goes to this periplasmic space right here, and now let's say the sperm is right here, right? When it fuses with this vital membrane, plasma membrane right here, like here, the front layers of this sperm started melting away, right? So basically, let's just say this is a sperm right here. The sperm head is started sort of melting away, and you only have this nucleus right here with this sperm, which is going to get it's going to take it inside, and usually this is usually taken through sort of endocytically process, right? And now let's just say this egg, this is a male nucleus is here, all right, and this is a female, obviously. Now what is going to happen right here? When this sperm touches the vital membrane of the oocyte, the cells around, around there, they started major depolarizations happening. The current, the voltage gate, there is big. These cells down here start going depolarization, right? And because they're going deeper, they're basically making the positive voltage, all right, current they're making, and that basically one of the reasons why it actually prevents the other sperm to actually fuse, all right? So what causes to prevent the polyspermy is that one of the major depolarizations happens. On top of that, there are these different granules, these are called cortical granules, which ovum has. They started actually fuse, because there's a major depolarization happens, there is a positive charges here that basically causes the different lysosomal enzymes to fuse this cortical granules and start releasing their content, right? And when that happens, right, when these cells are going depolarizations, the calcium channels opens up and a lot of the calcium started coming inside, and that basically causes this cortical granules to fuse to the cells, right? And that basically also provides another protective layer to prevent polyspermy, all right? Now, again, you have to remember the two concepts. In order for fertilization to occur, for this, there has to be two processes that needs to occur. The capacitations remove the glycoprotein. On top of that, there has to be acrosomal reaction that happens, right? The sperm has to go through that. And then after that, look, and for the oocytes, these are oocytes barrier. And the way the covalent radiators are destroyed is because whenever sperm and cum touches, they basically start releasing those hyaluronic enzymes, and they start destroying all the hyaluronic acid. That's one of the things they do. And then there's a zona pellucida, different layer. There's a receptor, GP3, you have to remember that. It binds to that, right? It binds to that, and basically then after they start penetrating, and after that, later, the sperm head basically will fuse, the plasma membrane will fuse with the sperm plasma membrane plus the oocyte plasma membrane. When they fuse one another, really what happens is that, that can cause the major depolarization to occur, and which can prevent the polyspermy, all right? So here I'm actually showing an image of how fertilizations occurs, and you have to remember there are three phases that you have to remember, right? The first phase is the penetrations of the corona radiata, and that is done by the sperm, okay? This is the first stage of the fertilization to occur. That needs to happen. And second is when the fertilizations when the sperm penetrates or when it binds to the GP3 receptor, located on the zona pellucida, that basically causes an acrosomal reaction to occur, right? On top of that, there is also penetrations of zona pellucida occurs that basically causes the cell to go through depolarizations, and then the cortical granules of those lysosomes from the oocyte cytoplasm, they fuse in the membrane, and basically that causes more calcium ion to go inside, and causing the whole cell to be depolarized and preventing what? Polyspermy, right? And the phase 3 is the fusions of the sperm with the oocyte cell membrane. When this really happens, so really what happens is that the entire sperm, except the cell membrane, into the cytoplasms of the secondary oocytes, right? Which are usually located in the metaphase of the meiosis 2. And that is something that you have to remember. Now after this, what do we talk about? Now let's just say that, whenever you have this nucleus is here, let's just write it down here. You have this, we'll make this as, let's just say this is female, and then let's just say this is, okay, let's just say this. You have this is a one here, and other one is this one. What is the whole concept of here? And right here, this is one. Remember, this is, let's just say, male, and this is female, all right? Basically, when this happens, right, now you have a male and female nucleus is there. Before they fuse one another, this, let's just say this female, which was in secondary oocytes, right? She basically completes her second meiotic divisions, okay? That's what she did. And by doing that, really what happens? Right now, this is what? There's one N, because one nucleus, and then you have one chromatids, right? And simply here, one nucleus and one chromatid, that's what happens. But then this will start multiplying like this. What happens? And basically, look, still there is a one chromatids. Remember, chromatids are count based on the numbers of centromeres. So there's a process of DNA synthesis happens, right? And look, and then basically, this is what's going to lead into. And same thing started happening here too, right? That's what happens. And slowly what happens is that these guys come, and whole concept of the growth of this nucleus is happening right here. This whole growth of nucleus is what is going to make something called pronucleus inside the cell, all right? Pronucleus inside the cell. Now this pronucleus, right, from both male and female pronucleus, right, when they fuse together like this, right, that fusions, let's just say this is a pronucleus right here, okay, and then this is, let's just say this. Now when this fuse together like this, then they basically make, okay, with the red I'm going to make this, they make something called, look, and you have a nucleus, of course, right? Now this is what is called your zygote. And sometimes, sometimes that we say that, a lot of people say that this is the start of a life, right? Now, this is what I have for fertilizations. Okay, guys, one of the concepts that you should remember is, let me quickly touch some of the stuff. Sometimes, there's a mutations on, let's say this is ACD1, all right, or let's just say that GP3. If there's a mutation, then what happens? Pregnancy would not occur. There is basically infertility will occur because you need to have both of this. Or let's just say if the acrosomal reaction does not happen or capacitation doesn't happen, then basically this also prevents for fertilization to occur, right? So this is a very, very important concept that you have to remember that. So I think that I talked about the most important concept here about what fertilization is, and this is not a super detailed materials, but I talked about what are the most important concepts that could be tested on your exams. All right, thank you.